The phone vibrated on the kitchen counter. You glanced down. A new message from your clinic. Lab results available. You hesitated, the spoon half raised to your cereal. Outside, the morning sun hit the rim of the coffee mug, steam curling up. You could feel it brushing your fingers, warm. You shifted your weight from one foot to the other, ankles stiff from sitting too long. Your gaze dropped to your toes. Something felt different, not painful, just off. A faint numbness along the ball of your foot. Pins and needles that had appeared several mornings in a row. You'd shrugged it off each time, thinking it was fatigue, maybe the mattress, maybe nothing. In the clinic, the nurse taps a screen, prints a sheet. The numbers will be on that paper. But your body has been sending signals for weeks. The feet, the soles, the skin between toes, they speak first. The lab will tell you what your nerves already know. I've watched this for a decade. Patients come in, focused on the sheet, unaware that their body has been outlining the story in subtle cues. And the first place those cues appear is often, always the feet. You lift a foot, turn it slightly, trace a finger along the arch. Numbness, tingling. The moment stretches. You realize you've been noticing this, but never connecting it to anything. Most people assume high blood sugar shows up only in numbers. You go in for routine labs, wait for the phlebotomist's needle, glance at the printed results and think, that's it. The body, they believe, is silent until the lab confirms the diagnosis. It's not uncommon. Years of patient accounts reinforce this. People notice fatigue, dry skin, or minor tingling and dismiss it. They attribute it to aging, long walks, or new shoes. And in everyday conversation, the story repeats. I only knew I had diabetes when the doctor told me. The confusion persists for several reasons. One, the early physical signs are subtle. Tingling in the feet, slow healing small cuts, slight swelling. These can be intermittent or easily explained away. Two, education often focuses on laboratory thresholds and numbers. Fasting glucose, HbA1c. The physiological precursors rarely make it into routine public awareness. Health systems emphasize diagnosis over early detection in everyday language. Preventive cues are documented, yes, but they're often buried in professional guidelines or medical literature. A patient reading a pamphlet might see, check your feet regularly, but without context, that instruction feels generic, not connected to blood sugar. Even reputable sources like the Centers for Disease Control and Prevention note that a significant portion of adults with diabetes are unaware of their condition. Estimates suggest 1 in 5 cases remain undiagnosed, primarily because the early signs are overlooked or misinterpreted. In practice, this means a person can experience nerve changes, circulatory shifts, or skin alterations for months, even years, before any laboratory confirmation. The body communicates continuously. The signals are there, especially in the extremities. Most just aren't trained to read them. The stage is set. The misconception is clear. Diabetes is only a lab result. But observation, attention, and understanding subtle physiological cues can give advance notice. The next sections will detail what those cues are and why they matter. Peripheral neuropathy, delayed wound healing, and changes in skin or circulation are well documented in adults with chronic elevated blood sugar. According to the American Diabetes Association, ADA, nearly 50% of people with diabetes develop peripheral neuropathy over time. These nerve changes often begin in the feet and lower legs, preceding formal diagnosis in many cases. The Centers for Disease Control and Prevention, CDC, reports that about 21% of adults with diabetes in the United States are unaware of their condition. This translates to millions of individuals who may already exhibit early physiological changes, yet remain undiagnosed. Observational studies indicate that these undetected cases frequently show subtle signs such as tingling, burning sensations, or numbness in the feet months or even years before laboratory confirmation. Clinical research also supports the link between high blood sugar and impaired wound healing. A review in the Journal of Diabetes Research details how hyperglycemia affects microvascular circulation, limiting oxygen and nutrient delivery to peripheral tissues. Consequently, minor cuts or blisters may persist longer than normal, increasing vulnerability to infection. The CDC identifies diabetic foot ulcers as a leading cause of non-traumatic lower limb amputations in the U.S., with over 100,000 cases annually. Early detection of these precursor signs can help prevent severe outcomes. In addition to nerve and vascular effects, studies highlight the association between elevated glucose and skin or hair changes. Research published in Diabetes, Obesity, and Metabolism found that hair thinning or loss on the lower extremities correlates with peripheral artery disease in diabetic patients. Similarly, skin discoloration around the ankles has been observed as an early indicator of compromised circulation, detectable on average 18 months before diagnosis. The National Kidney Foundation notes that edema in the lower extremities can be an early sign of kidney involvement in diabetes. Fluid retention in the feet and ankles reflects impaired renal filtration, which is often directly related to sustained hyperglycemia. Regular observation, combined with routine clinical screening, allows healthcare providers to identify these patterns before more serious complications arise. Finally, peer-reviewed consensus statements, including those from the World Health Organization, WHO, emphasize the value of patient awareness and early detection. While a laboratory test remains the definitive method for diagnosing diabetes, recognizing subtle physiological cues, especially in the feet, provides actionable information that complements formal testing. These findings demonstrate that the body often signals risk long before lab results do. Consistent observation, paired with timely professional evaluation, aligns with best practices recommended by major health authorities. The first changes begin in the peripheral nerves. Long before a blood test signals high glucose, the nerves in the feet and lower legs start responding differently. Each nerve is coated in a protective layer, much like insulation around an electrical wire. Elevated blood sugar gradually damages this sheath, slowing the transmission of signals. Patients often notice this as tingling, numbness, or pins and needles sensations. At the same time, the vascular system is affected. Persistent hyperglycemia causes microvascular damage. Tiny blood vessels become narrow, stiffer, and less capable of delivering oxygen and nutrients to peripheral tissues. The skin, hair follicles, and nerve endings in the feet rely on this microcirculation. When it diminishes, the tissue starts to signal distress through visible and tactile cues: redness, darkening, or hair thinning. These signs appear silently yet consistently before any lab result registers abnormal glucose levels. Chronic high blood sugar also impairs the body's natural repair mechanisms. White blood cells, essential for tissue repair, cannot reach damaged areas efficiently when blood flow is restricted. Collagen synthesis slows, leaving minor injuries, small cuts, blisters, or cracks, persisting longer than usual. Over time, even routine friction from walking or shoes can become a potential site for ulceration. Autonomic nerves, the system controlling involuntary functions such as sweat production and skin moisture, are also vulnerable. When these nerves are compromised, sweat glands in the feet stop functioning effectively, leading to dry, cracked skin. Unlike normal seasonal dryness, this dryness originates internally. Moisturizers may temporarily ease discomfort, but cannot reverse the underlying autonomic nerve impairment. Kidney function interacts with these peripheral changes as well. High glucose damages glomeruli, the kidney's filtering units, causing fluid retention in the lower extremities. This results in visible swelling, particularly around the ankles. Fluid accumulation further challenges circulation, amplifying stress on nerves and skin tissue. At the cellular level, persistent hyperglycemia triggers glycation, the binding of sugar molecules to proteins and lipids. This process produces advanced glycation end products, AGEs, which stiffen blood vessels and interfere with nerve function. Research in diabetes care demonstrates that AGE accumulation correlates with both neuropathic pain and microvascular complications in diabetes, linking biochemical changes directly to observable symptoms. Muscle tissue in the lower legs is affected indirectly. Reduced perfusion limits nutrient supply, and nerves controlling small muscle groups lose efficiency. This contributes to weakness, slower reflexes, and difficulty sensing minor injuries. The combination of vascular, neural, and muscular changes explains why the feet are often the first visible location where high blood sugar manifests. Taken together, these mechanisms show a coordinated chain of effects: Elevated glucose leads to nerve damage, leads to microvascular impairment, leads to delayed healing, leads to autonomic dysfunction, leads to observable signs in the feet. Understanding these links clarifies why attentive observation, even before formal lab tests, can provide early warnings. When elevated blood sugar persists over years, the cumulative effects on the feet and lower extremities can influence broader health outcomes. Nerve damage, left unrecognized, increases the likelihood of chronic peripheral neuropathy. According to the American Diabetes Association, nearly half of adults with diabetes will experience some degree of neuropathy during their lifetime, affecting mobility and balance. Impaired microcirculation also raises the probability of skin breakdown and ulceration. The Centers for Disease Control and Prevention reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States, with over 100,000 cases annually. Observational studies indicate that these ulcers typically arise from minor injuries that fail to heal due to restricted blood flow and impaired immune response. While not every small wound progresses to severe complications, persistent hyperglycemia substantially increases the risk. Kidney involvement, indicated by swelling in the lower legs, can precede or coincide with reduced renal function. The National Kidney Foundation notes that early lower extremity edema may signal diabetic kidney disease, which can affect fluid balance, blood pressure, and overall metabolic regulation. When addressed promptly, these changes can often be managed or mitigated through lifestyle modification and clinical monitoring. Hair loss, skin discoloration, and dryness are additional markers of vascular and autonomic stress. While largely cosmetic, they serve as reliable indicators of systemic microvascular compromise, often preceding more serious outcomes. Research in diabetes, obesity, and metabolism demonstrates that hair thinning on the lower extremities correlates with peripheral artery disease in adults with diabetes. Taken together, these findings show that early, subtle cues in the feet can provide a window into long-term health risks. Recognizing them does not guarantee outcomes, but it allows for timely monitoring, intervention, and informed discussions with healthcare providers. Identifying these signs early improves the probability of maintaining functional independence, mobility, and quality of life over the years. Professional guidelines consistently emphasize early detection and preventive monitoring in adults at risk for diabetes. The American Diabetes Association, ADA, standards of care recommend routine foot inspections for adults with diabetes or prediabetes, highlighting that peripheral neuropathy and microvascular changes can appear before formal diagnosis. These inspections are recognized as a standard preventive measure, not optional. Similarly, the Centers for Disease Control and Prevention, CDC, advises that clinicians assess both neuropathic and vascular health in the lower extremities, including sensory testing, skin examination, and observation of circulation. These assessments align with large-scale epidemiological data showing that early intervention reduces the risk of foot ulcers and related complications. Consensus statements from the World Health Organization, WHO, reinforce that patient education on early warning signs is critical. Awareness of subtle cues, tingling, numbness, slow-healing skin, discoloration, swelling, enables individuals to seek evaluation and implement lifestyle adjustments prior to serious complications. Importantly, the WHO notes that these signs are adjuncts to, not substitutes for, laboratory-based diagnosis. Where debate exists, it typically concerns the frequency and methodology of home or clinical monitoring. Some associations suggest formal sensory testing annually, while others recommend patient self-observation more frequently. Evidence supports both approaches, but there is no universal standard that guarantees earlier detection beyond routine clinical screening. Experts agree on several core principles: regular foot inspections by patients and healthcare providers, prompt evaluation of any persistent changes in sensation, skin, or circulation, lifestyle measures, including moderate physical activity, balanced diet, and hydration as supportive interventions, laboratory testing to confirm diagnosis and guide clinical management. These recommendations reflect broad professional agreement. They are evidence-based, grounded in peer-reviewed research and consensus, and emphasize prevention, awareness, and timely intervention without relying on fear-based messaging. Observation is the first step. Sitting quietly after a shower, take a few moments to look at the tops and soles of your feet. Note any unusual color changes, dryness, cracks, or hair thinning. Check between the toes for small cuts or blisters. These are visual cues your body provides, and noticing them early allows for timely discussion with a healthcare professional. Movement supports circulation. Regular walking, even 20 to 30 minutes a day, helps blood flow to the feet, nourishing nerves, skin, and small muscles. Simple foot exercises, such as ankle circles, toe raises, and calf stretches, can be integrated into a morning routine without specialized equipment. Hydration and diet play a complementary role. Drinking water throughout the day supports kidney function and tissue health. Including fiber-rich foods, vegetables, legumes, and whole grains helps moderate blood sugar fluctuations, which in turn reduces stress on nerves and circulation. These measures are general health practices. They do not diagnose or treat diabetes, nor do they replace laboratory testing. Instead, they provide a practical way to monitor early warning signs and support overall lower extremity health. Questions to consider with a healthcare provider include: are observed changes persistent? Do numbness, tingling, or burning sensations occur regularly? Has swelling developed? Discussing these observations can guide appropriate testing and early intervention, aligning with professional recommendations from the ADA, CDC, and WHO. You've seen the sequence. Small cues, tingling, dryness, swelling, color changes, hair thinning, signal what your body has been managing quietly. They are not sudden alarms, they are subtle markers, often overlooked. Taking 30 seconds each day to observe your feet can provide insight long before lab numbers appear. Movement, hydration, and dietary awareness strengthen the systems that support circulation and nerve function. These steps are simple, repeatable, and under your control. Awareness does not replace professional care, but it does create opportunity. By noticing these signals, you gain the chance to discuss them with a healthcare provider, to plan monitoring, and to make lifestyle adjustments that have measurable impact. This process is forward-looking. It is about maintaining mobility, functional independence, and quality of life. There is no urgency born of fear, only the value of observation, knowledge, and timely action. Look at your body as it communicates. Listen. Respond. The more attuned you are, the more effectively you can collaborate with your healthcare team to manage risk and protect health. Medical disclaimer. The information provided in this video/article is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider regarding any questions about your health, symptoms, or concerns about diabetes or related conditions. Observing signs in the feet or changes in sensation does not confirm a diagnosis. Laboratory testing and professional evaluation are necessary to determine your health status. Reliance on the information provided is at your own risk. For personalized guidance, scheduling an appointment with a licensed healthcare professional is recommended.